Today, the Ministry of Interior and Coordination, along with the Ministry of Health, has had a good deliberative meeting with the Interfaith Council. And in today's meeting, we've been able to take a review of the current COVID situation in the country, and particularly also focusing on the current surges that we're experiencing in 13 counties in the Luo Nyanza region. Just to share with you, in terms of what the COVID situation looks like internationally, I'm sure you're all aware that COVID remains a key health agenda. We have close to 176 million confirmed cases worldwide. And when we narrow down back to home here in Kenya, we've had close to 1.9 million cases confirmed here. When we look at our positivity rates, as at yesterday, in the country, we were at about 8.2%. And I'm aware by now we are all sure and have understood that 8.2% is still a worrying metric when it comes to the positivity rate for COVID-19. We've been able to review the current measures that are in place. We've been able to deep dive into the 13 counties. And I can tell you that right now the situation remains one that is critical in the 13 counties. We have engaged with the different county governments of the 13 counties, and we are mounting a response that is focusing on 4 key measures, of that being coordination. The Ministry of Health has been able to deploy a multi-agency team along with field epidemiologists who are already in those counties, working together with county governments to be able to, one, survey the situation and mount a response. When we look at the numbers in the 13 counties, particularly comparing them with the 47 counties in the country, one key thing that is worrying us is that the attack rate, which is a measure of the new cases within these counties, has almost gone up 15-fold in these counties. And so really we need to pay attention to all the adherent measures that have been set, along with all the restrictions that we've been able to release in the past 1 week. In terms of other focus measures that we're putting in place, surveillance is very key, and particularly because we're all aware that our neighboring counties are also experiencing surges, particularly that neighbors the Luo Nyanza region. And one key thing of concern for us is the Delta virus. And so what we're doing in the 13 counties is that we've mounted a key surveillance response that is focusing on genomic sequencing. We have our labs there, particularly the Cambridge lab, that is picking samples so that we can establish the number of Delta virus cases that may be there. And what is of concern and of importance, and particularly to those who reside in those 13 counties, is that we have been able to pick out cases of the Delta virus, and it is important for us to ensure that we really adhere to these measures because we want to prevent community transmission. We want to prevent a situation where this virus is not jumping from one person to another in the community. And so we're really calling upon you to collaborate with your county departments of health, collaborate with the Ministry of Health, collaborate with the Ministry of Interior when it comes to meeting these measures. A key element, again, that is of focus in these counties is the availability of isolation beds. We are working with all the county governments to ensure that we get the requisite surge capacity for isolation beds. We've also coupled this with oxygen. We are aware there are certain challenges when it comes to oxygen, and we are working to ensure that we have stocks available for this. IPC measures, this is infection prevention control, remains very crucial as well. We are working to mobilize personal protective equipment to ensure our healthcare workers are protected in the counties as they serve Wananchi. And so right now, our call is to you, Mwananchi, in these counties, to really adhere to these measures, to work with all the people who are trying to ensure that they protect your lives and that we're able to really ensure that we can stamp down this issue of COVID in those 13 counties.